Voila.
Good afternoon to everybody. Hope you're all doing well, staying safe.
So this week, Dr. Tamerisa, I wanted you to talk about fatty liver. It's our topic of the week. And so we've set up a series of Instagram and social media posts. And I thought maybe you could just start today with telling everybody what fatty liver is and how you treat it.
Yeah, absolutely. So fatty liver disease is actually a pretty common finding for us. And I think, it's obviously increasing in prevalence, and we probably are doing more to look for it and actively try to reverse it. But fatty liver disease is where the liver cells get displaced, or the liver gets infiltrated with fatty tissue, and the liver cells start to get displaced by these fat cells that accumulate in the liver. And then over a period of time, that gradual replacement of liver cells by fatty cells will cause some inflammation in the liver. And if it gets inflamed long enough, obviously, then you start to develop some scar tissue, and scar tissue that happens progressively over time as the liver scars and scars and scars. The function of the liver becomes compromised, and this is where we might see something like cirrhosis happening. Usually it's a very gradual, slow process. It usually happens over years. We're talking 15, 20 years of time. So there's plenty of time to find it and reverse it before we get to that point. And I think a lot of fatty liver disease, unfortunately, is related to poor diet, poor control over cholesterol, and just sedentary lifestyles. So I think a lot of us are, maybe not making the best choices in terms of diet, and certainly getting up and being more active is going to be helpful to burn some of that fat. And so we have actually some very specific dietary recommendations that we might implement. We can also see fatty liver disease as a result of excessive alcohol use. So alcohol, again, will cause fat accumulation in the liver, and then it tends to progressively cause this problem with liver cells being replaced by fat cells, and progressively causing scarring.
Mm-hmm. I do want to ask you some questions about some of the tests that you run, but I also want to tell patients from the nutrition standpoint. I often get these patients sent to me from Dr. Tamerisa or one of our other physicians here, and I like to tell patients when they come in and we're talking about fatty liver that much like diabetes and pre-diabetes is completely reversible through lifestyle changes, including diet, and that's where we compare fatty liver. It is completely reversible and manageable with lifestyle and diet changes. However, once it progresses to something more severe like cirrhosis, or in the case of pre-diabetes to diabetes, then it's no longer reversible and becomes more like a crisis management situation. So, and a lot of times with diet, it's, a lot of people think they have to go on a low-fat diet, but really it's carbohydrates. When they're eaten in excess, those are what are broken down and stored in your body as fat and can accumulate, like you mentioned.
Absolutely, and that's a common misconception. People often think it is the fatty foods that are causing fatty liver, which might make sense if you just think about fat. But the thing is that the carbohydrates are what are being converted into fat and being stored in the liver, and it's really hard to mobilize that fat out of the liver once it's accumulated to a certain point. So it really does take a really sort of dedicated nutrition plan, and oftentimes an exercise regimen that will help to burn some of that fat. Obviously, the first key is going to be diet, and this is where something like a ketogenic diet is actually the diet that is recommended to start to mobilize that fat out of the liver. Ketogenic diets are not diets that we can stay on forever. So, we may use it initially to get some fat mobilization, and then try to transition into a more healthy diet that's sustainable. But the biggest thing is to really look at what you're eating, and high fructose corn syrup is something that we know is a big no-no for people who are showing fatty liver disease probably shouldn't be eaten by any of us, but especially those who've been diagnosed with fatty liver disease, high fructose corn syrup is a terrible thing to have in our diets. So I really would have people start looking at the labels, and it's in so many things. I mean, it's just even in things you wouldn't even think would have it in there. It's in there. It's in, peanut butters and jams and crackers and all kinds of food. Yeah. So you'd be surprised if you start looking for it, how many things actually have high fructose corn syrup in there, but that's got to get out of our diet. So the first thing I tell somebody who I'm diagnosing with fatty liver disease is to get that high fructose corn syrup out of their diet. And really, for that matter, all simple, carbohydrates, all sugars need to be eliminated. Sodas are going to be terrible for somebody with fatty liver disease because it not only has the high fructose corn syrup, it's got sugars, and then it's got artificial sweeteners, and people think, artificial sweeteners are healthy, but those aren't healthy either. And so we really need to be looking at.
So we do have a question about some of the signs of fatty liver. So maybe you can talk to us about diagnosis and how it starts.
Yeah, so unfortunately, fatty liver disease really initially doesn't have a lot of symptoms. So these are often people that we're finding fatty liver disease on when we're looking for something else. We're doing an ultrasound of the liver, for example, maybe, in the event that somebody's got abdominal pain, or we suspect some gallstone type symptoms, we may be doing an ultrasound on those patients, and then we're seeing the liver being fatty. And so, unfortunately, there aren't any symptoms. Oftentimes there are risk factors, though, and so we should probably talk about who may be at risk for fatty liver disease. And these are often people who may be overweight. They may be somebody who has a family history of fatty liver disease. We know that certain racial groups, ethnicities may have a higher risk of fatty liver disease, and typically Hispanic populations tend to have more of that, probably somewhat genetically mediated. Obviously, if you've had a poor diet from childhood, which often is the case, you should be at least thinking about it. If you have alcohol use on a regular basis, you may likely have fatty liver disease. So really symptoms, by the time you exhibit symptoms of fatty liver disease, it's gone too far. So that's not the point where we would ideally recognize something like this.
Right. So it sounds like ultrasound of the liver.
Ultrasound is going to be helpful to look at fatty infiltration of the liver, and that's often the test that we may see it on first. There are some other tests that can give us a sense of how much fatty liver disease is there. So we have a test where it's called elastography, and this is where we can kind of test the resilience of the liver and maybe look for some advanced fatty liver changes. Oftentimes we'll use lab work, so if we see blood tests that looking at liver enzymes, if the liver enzymes are elevated, and typically the liver enzymes will be moderately elevated, they're not going to be super high, they're just going to be kind of high-ish, maybe 2 times normal, somewhere in that range. And then, that we suspect fatty liver when we see something like that. That's what we're looking for. It used to be that we thought we needed to do a liver biopsy on people who were showing us fatty liver on an ultrasound. And we now have some more advanced tools where we don't need to do a liver biopsy in every case. But oftentimes, when we see it, we are going to start a process of reversing it, and that means really getting into a diet where we're combing through what's in the diet and what we can do to eliminate some of those things, and then getting on a treatment plan that can reverse some of that.
Okay, and then are there any medications people can take?
Yeah, so medications, there's a lot in the works in terms of actual medications for fatty liver disease, but we do think there may be some things that can help to support fatty liver disease. So oftentimes we'll use omega fatty acids to help support the process of reversing some of the fatty liver disease. Vitamin E has been suggested to be a helpful tool in terms of mobilizing fat, and we may also use milk thistle, for example. None of, oftentimes some of these things are not FDA regulated, or they're not quote unquote enough scientific evidence or public, trials that are going to support some of this stuff. But we know that some of these things can be useful to us, and there are definitely some. There's a lot of research going on fatty liver disease treatments in terms of actual medication.
Yeah, one of the greatest things I've read, I think, is by Dr. Gabby. He or she is a functional medicine doctor, and it's one of my textbooks in school. But they were talking about how functional medicine or integrative medicine isn't the effect of one single modality on its own, like you're mentioning, diet, supplements, all of these testing. It's the combination of all of it, and I think that's what makes our practice very unique and very different.
Yeah, so oftentimes, we may kind of brush off fatty liver disease if we're not seeing any liver, abnormalities on lab work, for example, or if we're not seeing somebody with more advanced fatty liver disease, we may brush it off as saying, don't worry about it. But really, that's the time to actually worry about it and try to change the course of the fatty liver disease. So, if we ever do see it on an ultrasound and it's not something that's really causing any other lab abnormalities or any functional abnormalities with the liver, really that's the time to kind of get a good handle on it and try to reverse that by doing, again, a dietary protocol, whatever that may look like, getting some weight loss, and even a small change in weight actually can have a big impact on the fatty liver. So sometimes even 5 to 10% of a change in body weight really can affect the fat and try to mobilize the fat out of the liver. And that's really the goal here, is to try to get the fat out of the liver and start to melt that fat. And so what you want to do is try to force your body to utilize the fat reserves in the liver as fuel sources. So rather than eat the carbohydrates and use the carbohydrates for your fuel source, what you want to do is force your body to take that fat and metabolize it out of the liver and use that for energy.
Exactly. Well, thank you for talking about that. So stay tuned. We're going to be posting every day this week about fatty liver. So if you have any further questions about it, feel free to ask us. If you guys have any questions that you want us to answer next week, we'll be here again every Tuesday at 12:30, office hours with Dr. Tamerisa. Feel free to leave your questions or send us a private message, and we're happy to answer.
Yeah, absolutely. Look forward to seeing you.
All right. Have a great day, everybody.
Bye. Be
Bye.
safe.